Perfect. Well, Sarah, thank you so much for the invitation for the Kansas Council on Developmental Disabilities to join you all this afternoon. We're really excited to give you an overview of the work that we're doing in Kansas to address the health equity and outcome concerns of the intellectual and developmental disabilities community across our state. I know we have several folks coming to us from all over the country, and we'll talk about maybe some of the unique aspects of Kansas throughout the presentation. Allyson and I, as Sarah knows, we're super informal, so stop us at any point if you have questions. We're happy to take those, but just a little bit, Sarah mentioned it, but if you go to the next slide, I thought I'd give you just a little bit of background on me, and
I don't need anything.
Whoever it is, could you mute yourself? Okay.
The good old mute button. And then I'll have Allyson jump in and give a little bit more about her background. But as Sarah mentioned, I've spent about 23 years in the disability community. I started off my career as a direct support professional to a young woman, Casey, you see up there, kind of on the top right of your screen there. I started working with Casey when I was 19 years old. Casey had a dual diagnosis of Down syndrome and autism, and she really was the catalyst for me becoming an advocate. I often like to say I'm more of an activist for people with intellectual and developmental disabilities, because I started to ask her mom and dad way back when, questions about why could she only have more than $2,000? Why wasn't a high school diploma an option? This is one of my favorites. Why does the Social Security Administration still call her mom every year and ask if she still has Down syndrome? And that really led me to a career where I spent most of my time, or I spent 15 years in Washington, D.C. As Sarah mentioned, I ran the National Advocacy and Policy Center for the National Down Syndrome Society, and then took over as the CEO of that organization, hard to believe, 10 years ago in 2014, and did that for about 6 more years. And ended up stepping down to do a short stint in politics, but then got second in a very crazy primary in Kansas and got back to my disability roots. And it's kind of interesting because one of the projects that I took on right after my short stint in politics was actually, I had the honor to work during the COVID pandemic as part of a partnership between, and I think this will resonate with a lot of folks on the call, I had a partnership where I was the interface between Missouri's Department of Health and Human Services and their Medicaid program with the Association of State and Territorial Health Officials and the governor's office. So I pushed in and helped Missouri respond to the COVID pandemic, specifically to make sure that people with disabilities, family members, and caregivers were included in the state's response. I live in Kansas, but I'm like in the Kansas City area, and I'm like 5 minutes to Missouri. So it was really interesting, and I learned a lot about public health. I learned a lot about being immersed in a state, the disconnect between Medicaid as a healthcare and insurance entity, what it pays for, and then how that correlates back to true health equity and outcomes. And we know in this community, a lot of the barriers and the challenges exist around navigation and knowing what benefits are out there, what to ask for, how to get on wait lists, and all of the other things that make it very bureaucratic and complicated for individuals and families. I quickly learned that in Missouri, but it's even worse in Kansas, we have 11 back doors to get supports and services in Kansas. So families and caregivers are just navigating a very archaic, outdated system. And so when I was asked in September of 2022 to come over and take on the executive director role for the Kansas Council on Developmental Disabilities. I wanted to take some of those lessons learned from the COVID pandemic and see what we could do in this new era of healthcare, health equity, and healthcare delivery to break down some of the silos and spur more collaboration and partnerships inside and outside of the disability community. And Allyson's going to talk a lot about those partnerships that we're leveraging in our state. The other thing I'll say on a personal level, that we lost Casey in January of 2021, a month before the COVID vaccine was approved and came online. And personally, I went through that journey as her legal co-guardian with her mom and her sister during that process, and saw just a lot of the breakdowns and barriers of individuals with disabilities living in congregate care settings. And she lived in a group home in Lenexa, Kansas, about 10-15 minutes from where I live. Breakdown in protocols, just a whole host of how our community really wasn't prioritized in the response. And so I think we still, obviously feel the pain of our loss, and also know that we still haven't solved, all of the issues and all of the challenges ahead. And so we remain, very, very focused on what we can do as a council to address this. And our goal with Allyson's leadership is really to develop what we hope is a proof of concept in Kansas with our coalition that other states can hopefully leverage and learn. So we appreciate, Sara, this partnership with you and you bringing us kind of along in this national foray as our little tiny council tries to mix things up and change things up in Kansas. So next slide, and I'm going to have Allyson introduce herself as our amazing director of this coalition. Going to go to the next slide.
Perfect, thank you. Yeah, so as Sara said, I am the director of this Health Equity and Outcomes Coalition, which has been very exciting, and I'm learning a lot. Like Sara, I started out as a direct support provider to a young woman with autism, which you'll see there in front of that Christmas tree. And she was also the catalyst for my work in the IDD community. I went to receive my undergraduate degree in speech language pathology, where I worked in a hospital for a little bit, and I started hearing families' concerns, and I thought maybe I should go into public policy instead. So then I pursued a master's in public policy in DC, where I was also the executive director of a Gigi's Playhouse, which I think started in Chicago. So Sara, right up by you. And that is a Down Syndrome Achievement Center that provides free speech therapy, physical therapy, and OT. So I had a lot of fun there. And then I met Sara Hart Weir, and she brought me over to the council where I am leading this coalition. And I'll talk a little bit about the coalition later, but we brought a lot of partners together who share their experience. And I think one of the biggest things that we've learned is that we work in silos. And so it's really just been through it all. One of the biggest benefits is just to learn more about the other resources that exist. I think we can go on to Sara's slides.
Awesome. Next slide.
All right, there we go.
Perfect. I think probably most of you are pretty familiar with our DD Council framework. In Kansas, like all states, we have a Developmental Disabilities Council. We obviously are federally funded through the Administration for Community Living, or ACL, as most of you probably are aware. Our unique mission in Kansas is we focus on empowering individuals with intellectual and developmental disabilities, family members and caregivers to lead systems change, build that capacity, and advocate for more inclusive communities. You see a little bit of that demonstrated here in our core principles. And if you jump to the next slide, if you're calling in from Chicago or Illinois or Texas or California, one of the things that you'll see, Sarah, if you jump to one more slide.
Why is it not jumping? All right,
Perfect, that's perfect.
all right, got it. That was the issue.
So, one of the things you'll see if you've worked with the DD Council in a much larger state than Kansas is that you're going to have a much larger team. Allyson and I have two incredible colleagues. You see Callie Simmons and Lola Cornell, who also work as part of our team. Traditionally, and I've been in this role for about a year and a half, our council has been really focused on being more of a grant making entity. And while we still do that and we still focus on funding partners that align with our mission and our 5-year plan, we are really trying to drive more of our programming through staff-led initiatives. And so Allyson leads and is completely dedicated to our Health Equity Coalition and running a lot of the programs and partnerships that we do with our state agencies. Our colleague Callie oversees our abuse, neglect, and exploitation program. We know that individuals, especially with intellectual and developmental disabilities, are at an increased risk of A&E issues. And so Callie works a lot with Adult Protective Services, our Attorney General's office, and we're trying to do more around training for first responders, law enforcement, and EMS throughout the state. And then our colleague Lola, Lola joined our team, Allyson, in January. And Lola is overseeing our new change agent program. And if you go to the next slide, in Kansas, we are rolling out a new program to get more self-advocates, moms, dads, and caregivers engaged in our federal and state advocacy. And Lola is dedicated to kind of that priority area 1, where we're trying to create leaders and empower advocacy so we can have better results in our state capital in Topeka, but also in Washington, D.C. The next slide is just a little bit more specifics on the council and what we're working on legislatively. Kansas, unlike most states, we have a very short legislative session, typically that runs from mid-January to usually mid-May. As most of you are probably aware, it's an election year. So our legislative session will probably, if all else fails and Allyson and I get lucky, and next week or the week after. We have a very, very short legislative session. And as somebody who's spent 15 years in Washington and worked on Capitol Hill, the best way to describe it is that things in Washington move like or syrup, if you will. And things in your state capital, especially in Kansas, it's like whack-a-mole. It's a sprint, not a marathon. So we have had a very busy legislative session. We have been working on issues related to our IDD waitlist. We've been working on issues to expand the Silver Alert system to include adults with intellectual and developmental disabilities that are at increased risk of wandering, especially as dementia or Alzheimer's sets in. We have been making strides to eliminate the practice of subminimum wage in Kansas, which is very, very exciting. And all the while through Allyson, Callie, and Lola, we've been doing a better job of making sure the voices of self-advocates and parents are very engaged and active with us on these legislative issues. So we've been having and supporting a lot more testimony and a lot more outreach from constituents all across our state to help us move things along. The next slide, I wanted to show you, or Allyson and I wanted to show you, two real world examples of what's in unfolding right now in Kansas. And this really is impactful and important to the health equity and outcomes coalition and the day-to-day programming that Allyson is leading. Our biggest issue right now, and I beg to argue that this is a large issue in many of the states that you're tuning in from this afternoon, is that our IDD waitlist in Kansas has reached an all-time high. We have 5,200 individuals with intellectual and developmental disabilities. Not only on that wait list, they're waiting 10, 11, in some cases 12 years to get those home and community-based waiver services, the HCBS services that individuals with intellectual disabilities need in order to have more community supports. Our wait list has not been prioritized, especially in the last 5 years. And Allyson, maybe you could drop in the chat our policy brief from our website as we're going along, because that policy brief really, Sara and the team here, demonstrates the disparities between where the money has been going in Kansas to support provider rate increases vis-a-vis supporting and funding individuals on our IDD wait list. We started as a council leading a lot of these conversations with fellow advocacy organizations back last summer to get everyone on the same page. Sometimes that's the biggest challenge, is getting all the disability groups to align and have the same legislative ask. And so we started working with our Secretary of what is our Disability and Aging Department, KCDDs, back in the summertime to get everyone on the same page so we could be successful in increasing funding for the IDD waitlist. We went into the 2024 session, again, with 5,200 individuals waiting 10 plus years for services, with zero funds to increase the IDD waitlist. In fact, our governor, despite a lot of media attention, and you see some of the media articles in the Associated Press and Kansas City Star here, did not include funding for the IDD waitlist in her initial budget. Because of our advocacy and because of some of the pressure that we applied in the media, she offered in middle of February what we call in policy terms governor's budget amendment to fund 250 additional slots. And then we worked with House leadership to double that to 500 slots. And so as we wind down our session, and House and Senate leadership, and in which will be kind of a conference budget package, we will have hopefully demonstrated our success and our value that we'll have 500 additional individuals come off that wait list and start receiving services, hopefully as soon as June and July. We have also in that proposal included a cap. So we cannot let that wait list get over 4,800 slots. And then we are already starting to work on a long-term strategy to get that list down to zero, because as we all know, it's absolutely unacceptable that individuals are having to wait this long, and the services, the HCBS supports and services should kick in, as soon as possible, especially after somebody transitions out of the school system into the community. And we're seeing a very big gap in how individuals are integrated into their community with and without those supports. And we all know one of the things that we can't quantify right now is the mental health or behavioral health toll that it takes on individuals when they can't access employment, they can't access housing, they can't access a day program or another support mechanism after they leave the school system because there's nowhere to go and they don't have the funds to access those types of services. So number one issue, and I think I wanted to be able, Sarah, to demonstrate kind of the real active advocacy push around this particular issue to the long-term kind of coalition and collaboration that we're leading the charge on under Allyson's leadership with the Formal Health Equity and Outcomes Coalition. So if we go to the next slide, I'm going to have Allyson jump back here and talk to you about how we stood up this coalition, the framework in terms of, how we've structured some of the lines of effort under her leadership, and the work that we're doing to pull in like-minded organizations, experts from folks that run adult special needs clinics for our population, to those that are running pediatric clinics, and then also what we're trying to do to ensure that disability is part of other organizations, whether that's the Kansas Nurses Association, AARP, and other entities that are addressing these issues, but are needing to do a better job of prioritizing our population and the work that we do. So Allyson, I'm going to stop talking and turn it over to you to talk about the vision for the coalition. And, Sara, again, happy to answer any questions at any point in time. Folks can come off mute or drop it in the chat.
Perfect, thank you. Yeah, so as Sara said, the IDD waitlist has been our biggest priority this legislative session. But I think beyond the waitlist, there's a lot of other issues in receiving health services in Kansas. And so as we were just having conversations with stakeholders, with families, self-advocates, and providers, we really saw the need to develop a coalition that could work together to build out a blueprint to address some of these issues that we're seeing beyond the wait list. And whether that's in primary care, specialized care, home and community-based services, across the spectrum. So I had a lot of cold calls. Sara and I met with a lot of people, new faces, like she said, that don't necessarily lead with IDD, but do affect our population. So we kind of developed a few goals just coming into it. That's improving the overall health across the lifespan. I think a lot of times in terms of healthcare for our IDD population, we focus on the pediatric care. I know especially in Kansas, we have an amazing Children's Mercy where a lot of our folks go, but then where do they go after they turn 18? And I think it's not an appropriate setting sometimes when they get into their 20s, 30s. So they do have to find care that fits their needs. And how do you transition? Increasing research participation, innovation, and outcomes. We do have a lot of research happening for our IDD population, but it's not enough, especially when it comes to dementia and Alzheimer's research, including the spectrum of autism in research. There's a lot happening at KU, so we're involving them in this. They also have a program called Hart, which is skilling up individuals with IDD to become researchers, because you can't be included in research unless you're included in the entire process. So finding ways to get them plugged into the systems and institutions in Kansas. Expanding resources to the aging population, because as most of you know, our healthcare is improving and individuals with IDD are living longer. And so how are we supporting them and their caregiver as they age? And making sure that we have our aging IDD population and aging caregivers at the table to be able to hear their voice and hear their needs. And then the last one, increasing diagnosis and treatment for behavioral and mental health conditions. I'm really excited to share the progress of this work group because originally when we built this coalition, we did not have this as one of our set work groups. And we were having a conversation with one of our managed care organizations, and they shared with us that they had to send an individual to Florida to receive behavioral health services because we didn't have the capacity in Kansas, and that's just completely unacceptable. So we are moving quickly there with our state agencies to be able to support individuals who have behavioral health needs, making sure that they don't have to travel out of state to receive these specialized services. So Sarah, you can move to the next slide. Thanks. So this just breaks down the 4 work groups that we designed to be able to meet those goals. In this pediatric to adult clinical care work group, we have Dr. Laura Gaffney, who is the only specialized adult clinical provider in the state of Kansas who serves our IDD population, and she's over at Advent Health. And like all of our providers that are in this group, they're an inch deep and a mile wide. They are in the clinic every day. They are serving our population. I think she has a wait list of about 800 people that are trying to see her. So she is doing the best she can to be able to advocate for her patients. So working one-on-one with her to be able to help support providers to see more people. And I think one of the initial issues that we found that can be a quick fix is the amount of paperwork and the lack of consistency in paperwork. I went into her office and she showed me 20 different versions of a Sarah, help me out.
Yes.
Oh, physical form, a physical form.
Yes.
Yeah, so she had 20 different versions of a physical form, and there only should be one, and it should be a quick download from the Kansas Department of Aging and Disability Services website. So that's just one initial thing that we can knock out. But being able to have the providers talk to each other across institutions, to be able to share in some of the issues that they're experiencing, and then some of the solutions. And another issue there is also, how are we serving our Western Kansas population? Because we don't really have providers out in Western Kansas that can see our population. So being able to figure out ways and solutions to serve them. The inclusive research component that I was talking about, the aging and caregiving work group, and then behavioral health. When we met in November at our launch on November 8th, which Sara was able to attend, we created work groups. We had everyone break out, and although we only gave them like 30 to 45 minutes, each group was able to identify 4 or 5 issues that they were seeing in their work groups and started to think about what a solution would look like on a state policy level, a federal policy level, whether that's creating a program or a resource in the state of Kansas. I think we decided on a plain language women's health guide, and a couple different just ways to address those issues. And then we also identified grant opportunities in some of these work groups that we were able to apply for, and actually we were awarded one. So very exciting stuff, which I will dive into to the next slide, I think. Sara, thanks. Oh, okay. So this just shows some of our coalition members. I think we have 62 members, and there are a couple from different organizations like KU. We have the Alzheimer's and Dementia Research Institution, but then we also have our KCDD. And then we also have KU Medical Center. So across these different organizations, we have several different representatives. One that I'm really excited about is the Kansas Hospice and Palliative Care, because I think that's a great resource for our IDD population. There's been some research that's been done about the benefits of palliative care and users with IDD. So being able to have them at the table has been very exciting. The Kansas State Nurses Association has been very involved. They've sent several different nurses who specialize in IDD care, but then some who don't necessarily. We have a nurse from the emergency room that has been a part of our coalition, and you never know who comes through the emergency room door. So being able to have a conversation about what it would look like for someone with IDD to come in is very important. So I'm really, really happy with the group of members that we have. And I do have cold calls about once a week with a new member. So I'm still recruiting and I'm still finding ways to get new people involved and at the table. Next slide, Sara. So I'm going to talk about just some of the barriers that we've identified in each of these work groups and some of the solutions that we've started to work on. Currently, we meet on a monthly basis for each group. And we're working on developing a 2024 work plan for each group, where I'm kind of trying to narrow it down with the group. Everyone is very active and has a lot of great ideas. So I'm trying to figure out what we can achieve in the next year. But I'll start with the pediatric to adult clinical care work group. like I said, it's just improving care for self-advocates, families, and caregivers, and then what that transition would look like. I've had a lot of amazing voices in this work group share that sometimes they have to go across state lines to receive specialized services. So how are we accommodating with that with Medicaid? And how can we work with our state agencies to be able to make it easier and more accessible for these families? And then coordination between clinical care institutions, making sure that our Western Kansas population is involved. We have a lot of our CDDOs, which are our community developmental disability organizations. And we have how many across Kansas, Sarah? 27 maybe? So making sure that they're a part of the conversation. Our Western Kansas folks have shared with us that they often send people to Colorado because they don't have the services in Kansas where they're at. And it's easier to drive to Colorado than to Kansas City. Heightened focus on women's health here. Something I'm really excited about in this group is we're developing a women's plain language guide, and it's going to be written by 2 self-advocates, an OBGYN, and then Dr. Gaffney, a primary care provider. And this is going to really dedicate a plain language guide to discuss cancer screenings, regular OBGYN appointments, what it's like to get a pap smear, what is PMS, what is a menstrual cycle. And I think having self-advocates helping write this is very critical to help make sure that it's accessible and the language is easy to read. And then standardizing forms, like I said, we're working with our Kansas Department of Aging and Disability Services to create standardized forms for providers and for self-advocates to use when they're going into a doctor's visit, and making sure that the standardized form that we decide on is one that the providers see as easy to use and easy for them to complete as well. And so we meet once a month on Wednesdays here. Sarah, next slide. And I am rushing through these, so if anyone has any questions or wants me to slow down, please let me know. So this next one is inclusive research. That's attracting more federal dollars, investments to Kansas. I do have the honor of attending the Include conference, the Down Syndrome Include conference next month. So I'm really excited to kind of get some ideas of what other states are doing in terms of research and how they're investing dollars into their community. Autism research, I found in this work group that we do have some bias in autism research because we are including those with autism who are more likely to participate in research. So making sure that we include people across the spectrum, ensuring disabilities included into DEI policies and strategies in the healthcare and research field. A lot of times we talk about other minority communities, but we don't necessarily talk about disability and DEI. And then collaboration across institutions. One of the biggest wins of this work group has just been having KUMC talk to our KUDD Center, and then talking to Children's Mercy Research Institute. And I think in research, we don't talk about what we're currently working on because it is just kind of like a privacy concern. So sometimes having the groups being able to talk about the research that they're working on, the research that they've published, and then building a pipeline for co-research, which is what I mentioned earlier. This has been really exciting because I think we can take the standard practice for co-researchers without disabilities and just apply it to people with IDD. It's very important that they participate in research from the start. That way they can navigate where the research is heading. And then increasing research participation across all diagnosis. A lot of times we focus on autism and Down syndrome, but what are we doing with our rare genetic disorders and things like that? So we meet once a month on Tuesdays with this work group. Next one, Sarah. And then our behavioral health work group, we have done a lot of progress, and I'm really excited about this work group. We have an amazing self-advocate who is leading this group, and she is on the board of the Suicide HQ. So she has had experience, and she's okay with me sharing this. She's had experience calling the 988 crisis hotline. And for those of you who don't know, it is the suicide hotline. And when she called, the person who answered did not know what to do with a caller with autism. And so she has been helping develop training for Suicide HQ, which is who answers the hotline in the state of Kansas, for training for what would you do with a caller with IDD. She has also developed a toolkit that we're working on with her that helps self-advocates know when it's appropriate to call 988 and when you should call 911 and when you should seek a therapist. So it's been a great tool that I think we can hopefully flesh out and make public soon. And then the development of an IDD behavioral health toolkit, including nonverbal training materials. This is something we want to develop for both providers and self-advocates and parents. So providers can know what to do if they need direction towards a resource or a specialist, they can have that. And then for self-advocates and providers and parents, when they're coming into an appointment, let's say they're nonverbal and they need just a resource that they can share with the provider about their behavioral health needs instead of sitting through and trying to address those issues. They just have one sheet of paper they can give them. Increasing mental health supports for individuals with IDD, I think working with our self-advocates to see what our community needs and how we can better support them, whether that's a monthly webinar, whether that's a support group, and then supporting healthcare providers and mental health professionals, increasing training. I think a lot of professionals have expressed that they don't want to work with our IDD population because they are not properly trained for behavioral health needs. So making sure that providers feel safe, feel comfortable serving our population and are equipped if someone has behavioral health needs. Next slide. Oh, and we meet on the second Tuesday of every month, in case anyone's interested. Next slide. And then,
Did I, oh,
one
Right.
too many. Oh, perfect. And then our final work group is the Aging and Caregiving Crisis Work Group. Oh, something I forgot to mention on the last slide was our Kansas Department of Aging and Disability Services, in partnership with us, they have been awarded a grant to help develop a 988 crisis state plan. So working with so those who answers 988, but then also our first responders, policemen, firefighters, and going through this 988 state plan. So back to this work group. In this one, we are working with self-advocates, parents, nonprofit organizations that focus on our aging population, palliative and hospice care, to enhance resources for caregivers and guardians, opportunities for aging in place. We have a lot of families that have expressed that maybe they're on the wait list for 10 years, and then when they finally do and they're able to access day-hab services, it only offers from 10 to 3. So for a lot of families, that does not meet their needs. And so how are we improving the provider rate so that day-habs are able to provide full day-hab? Second thing is increasing capacity and flexibility in the IDD workforce and service offerings. We're really trying to focus on building up our DSP career ladder. So working with our other organizations and partners to increase training. One of our partners, InterHab, has a program where they're providing DSP Plus program where they can go through an apprenticeship to receive Department of Labor certification for a DSP. And then the ability to meet the IDD community where they are. What does in-home care look like? How are we supporting our IDD co-occurring dementia population? How can we pay family caregivers? And then supported living and residential care for those who need 24/7 care. What does going into a retirement home look like for someone with IDD? Because as you probably know, if they're on the home and community-based supports waiver and they try to go into a retirement home, they lose those supports. So how can we have just sort of a flow between the two so that you can still receive the necessary supports while also retiring and aging? And that meeting schedule is the second Monday of every month. And we also received a grant for this work group from our National Association of DD Councils, a community of practice where we're working in collaboration with our national council, but other states to see how we can better support our aging IDD population in the state of Kansas. And yeah, so I think I'm ready for the next slide. So this just shows kind of the focus of all 4 work groups and how we are meeting the need through state and federal policy. We will be attending the Disability Policy Summit in DC in 2 weeks, and we are bringing 2 self-advocates. The self-advocate I mentioned that's leading the behavioral health, and then Lola, our staff member, who are going to be talking with our legislators about the DSP House bill that recently just passed through the House, and talking about how a DSP can become a registered occupation, which will help us understand the shortage across the United States, but also in the state of Kansas, and attract more individuals to that career. And then we're collaborating with our state agencies to help address some of these barriers and challenges that we're seeing. And then we are also developing resources. Next slide. Okay, so if anyone is interested, I know that was like a brief overview and I could talk for hours about what we discuss in these work groups. But if anyone's interested, I'd be happy to talk one-on-one. If you have a particular interest in one of the work groups, I'd be happy to share the last meeting notes with you. Or if you want to just join, I'm happy to get you plugged in where you would like. And we also invite you to share any waitlist or workforce stories you have with us that we could share with our greater network. Okay, I think that's
Sarah, that was a crash course and everything. Like we're busy. It's been a whirlwind couple of months, but we're happy to take any questions.